what can I say? We service the public. It's difficult because it is also a business, but healthcare comes first in our office. So even if the situations are becoming more involved and we open the Pandora box, we still on track to finish.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Antoanela Garbacea of Prosthodontics and Implant Dentistry of Laguna Hills. She's been practicing medicine for over 20 years and has been teaching dentistry for 10 years. She started her own practice back in 2016 and has also published multiple research papers as well. So Dr. Garbacea, welcome and glad to have you here.
Thank you, Daniel. It's a great pleasure to be here with you on this podcast, sharing my background, my knowledge with everybody else. Thank you very much.
Yeah, so let's dive right into it. How did you get interested in dentistry?
Well, as a little girl, I always wanted to be in the healthcare. So early on, I wanted to be a medical doctor, but later on, I chose dentistry. I love dentistry. I like making my patients happy. I like treatment planning and changing lives through different types of grafting procedure, crowns, implants, rehabilitating actually our patients. This hasn't been always my dream. My parents' home back in Romania is right in front of the medical school, so I always wanted to go to the medical school, but it just became more dental than medical. So I always really want to be in healthcare.
Got it. Now, you have your own practice now. So what are the most popular treatments that your patients come to you for, and why do you think that they're so popular?
Prosthodontic, it's a specialty in dentistry that requires more precision, more accuracy, and we help patients that after general dentistry has exhausted all the possibilities are sent to us. So we are comprehensive. We work with other specialties. We do have an in-house lab, so we can have a quick turnaround, and we are very well versed in digital and analog dentistry. So there's a lot of avenues that we can take and treatment plan. We have a lot of options for our patients. I think this is what we can offer to the community.
Got it. And I think it's fascinating that people come to you once they've exhausted all other types of your normal dentistry options. But I think a lot of people just don't realize that there's a lot more options available to them. I think most people think they go to a dentist, they say you can't do anything, and then they're just stuck. They don't know what to do next.
Yeah, that's very true. So patients that have lost a lot of teeth, they're wearing partials. They are, adding one tooth at a time to their partial. The partial is not stable anymore, or dentures that are not stable due to bone resorption and remodeling. So we have to reach out to implants for anchorage, or full mouth rehabilitations where during decay or dry mouth patient experience different side effects from medication. So then we have to come in and salvage some of the teeth, or sometimes there is no way we can salvage any of the remaining teeth. So then prosthetics on implants are coming in.
Got it. Now, are there any new or emerging treatments that you're particularly excited about that are coming out?
Yes, digital dentistry. We are able, by scanning, to help patients that are having severe gag reflex or phobia of having an impression tray with an impression material in their mouth for a couple of minutes. I think the technology, especially the past 10 years, I graduated in 2014. I was mainly trained analog, but in the past 10 years, with the advent of digital dentistry scanners, very, very precise intraoral scanners, extraoral scanners, and having a lab in-house running a design center, we are able to offer so much more than articulating models. We can skip a couple of steps because the AI is helping. So it is really, modern dentistry has changed a lot in the past 10 years. So I think this is what we have in our little back pocket. Yes.
Yeah, that's fascinating, especially with people talking about AI and just it's already happening in dentistry, which I think is fascinating.
It is very fascinating. Yeah, right now we have robots placing implants, or there's a dynamic navigation assisted by AI, so that it's guiding the doctor's hand as we initially been planning, so they don't let you deviate from the original treatment plan or planning of the implant position. There's dynamic navigation. There's actually robots coming into dentistry. We have the milling machine and the printers. They're actually doing the job instead of a technician waxing up or cutting cutting back, the milling machine are cutting in, or the additive techniques from 3D printing, different types of resins, and 3D printing metal. So metal frames can be printed or can be milled. So it's quite fascinating.
Okay. Now, I'm sure that this AI technology, having the lab in-house, this is all things that differentiate your practice from others in the industry. But what are some other things that that you see that really sets you apart from some other people in your industry?
Well, I'm dual board certified, so I can very much place my own implants, treatment plan comprehensively, and then execute two parts of the treatment plan. We can definitely build the bone or reduce the bone if it's needed, place the implants, and also go ahead and plan the prosthetic. So it's actually in a backwards motion. We comprehensively treatment plan, we have the final end result in mind, and then from there we take a couple of steps back. The implants come at the end usually in treatment planning. So I'm certified in surgery and implant surgery, oral implantology, and in prosthodontics. So I can offer a little bit more to our patients. Nowadays, many specialties of general dentistry are very, very good training programs for surgery at any levels or any specialties, and we can offer that to our patients.
Got it. Now, I want to talk a little bit about education and how you educate your patients. You mentioned earlier that people come to you after they've exhausted a lot of the other options with your general dentistry. So I'm sure you get people that have, I wouldn't say lost hope, but they just don't know what options are available. I'm sure there's a lot of confusion and there's just a lot of lacking knowledge. So how do you approach educating your patients on what you do and how it can benefit them?
Yeah, that's great. Well, when a patient steps into our office, we're taking different images. We have 2D images. There's a panoramic radiograph, so regular full mount radiographs, and we take a 3D scan, so the 3D DICOM file, and we also take a intraoral scan image. And by combining all those three, and with a digital design software that we have in our lab, we are able to almost instantly choose one of the best options for them. How we educate them on multiple options? Well, we have removable and fixed options in dentistry. So if a patient would like a removable prosthesis not supported by implants, we do have a lot of similar cases that we treated, and we do have models. We show them the workflow. We explain them about 5 different appointments, how to create a removable prosthesis like a denture. If we adding implants, we show them the snap-on dentures, or call them over dentures. Or if the patient desires not to have any removable prosthetic implants in their mouth, we go into full implant supported. And we do have models, we have PowerPoints, we have videos. We can educate them, showing them results of our different other patients from being treatment in our office. Yeah, and then we have educational material. We have different pamphlets and trifolds. There are a lot of consent forms that are coming in with educational material. We have also our Instagram and on YouTube. There's a lot of material that patient can be directed towards their own learning.
Got it. Now, I'm sure even with all that education, I'm sure there's a lot of misconceptions that people have about the treatments that you offer and the benefits of it. What would you say are some of the most common misconceptions that people have when they come into your office?
For example, a denture patient, they would say, oh, all my family, from my grandfather, grandfather, my mother, my father, they all have dentures. I think I'm very hopeless. There is nothing else you can do for me. And then I'm miserable. I don't even wear dentures. I eat with my own gums. My dentures don't stay in my mouth. So that's a misconception that they have to suffer as well of their predecessors did when dentistry was not advanced. So we definitely present everything that we have in armamentarium, implants, or different anchorage devices that we can attach and help those dentures function a little better. So that will be one of the main misconceptions, what happened to the predecessors, or genetics being part of their genes, and then they're very hopeless. So there is hope out there, because technology nowadays is just almost unlimited. We have so many options for them. This will be the most common one. Another misconception will be, I don't have enough bone. They have met with other dentists that didn't have a CBCT machine or ways to quantify and explain if there is additional bone that they might be using in their mouths. Or we do have a remote anchorage access, so we have different ways to look into zygomatic implants, pterygoid implants, or sinus grafts. So there is a way to build the bone or find the bone where maybe just a regular radiograph couldn't find it or explain it. So that's another misconception. I don't have have bone, I don't have enough bone, I'm really hopeless. So this is pretty common so far.
It seems like a lot of the misconceptions all have to do around having no hope, and then you're bringing them that hope back.
I think so. Yeah. So if we do a thorough analysis, every new patient in our practice is going to meet with us twice. First, it's going to be data collection, and we are taking all the information, radiographs and images. And then the second time around, we do a thorough treatment planning based on the findings on the radiographs and based on the findings on our, own design that we recommend. And that opens up for them a whole wide horizon with different options, and then they are overwhelmed. Oh my gosh, I didn't even know that I can do this or this or this. And then we coach them, or we invite family members to help with making the decision of the best decision for them. And then besides that, before starting treatment, we do reach out to the physician, to their family physician or medical practitioner or specialty in medicine, and request medical clearance before we move on.
Got it. Now I want to talk a little bit about when someone comes in, when they've already chosen what treatment that they want to go with. How do you balance providing that relaxing experience for them, but at the same time also ensuring their safety and well-being? And kind of the joke is when people go to the dentist, they're always they're expecting lots of pain, and it's nothing that no one ever wants to go to the dentist to have their teeth drilled on. So how do you strike that balance as far as making sure they're relaxed, but also making sure that everything is done safely and with their well-being in mind?
Yeah, so we treat the whole person as a whole. We're looking at their well-being, we're looking at their medication list, we're looking at previous surgeries or previous experience in the dental chair. From the medical standpoint, like I said, we always have a clearance form available, and we take all the recommendations of the medical doctor in terms of anesthesia, in terms of pre-medication, antibiotics, and then stress reduction protocol for diabetes or any other pre-existing conditions. From the standpoint of sedation, we do offer oral sedation, that removes anxiety, takes off the edge. It's very, very common in dentistry, oral sedation. Or we reach out sometimes to a general anesthesia team, and we do have several providers that interview the patient. Some of our patients really need to be intubated, and we go the general anesthesia route, but the most common way is triazolam or diazepam taken the night before, or an hour, half an hour before the appointment, and we can go several hours, and it's safe. They are conscious that they are with us, they respond to our conversation, and things are a lot more easier for them in the dental chair.
Got it. Now, when it comes to the way that you provide treatment to your patients, I'm curious, because people think about dentistry or just medicine in general. I think most people have this preconception that there's a step-by-step process, there's a procedure that you follow. But what role do you feel that creativity plays in how you approach patient care?
Yes, we do have to know how to reroute our treatment plan or a surgery, that's a rescue, a procedure, or reroute the procedure. And we discuss what that with our patients. If the surgery goes in this direction and we find that we have to rebuild the bone, we take a step back, we just do bone grafting, we don't place the implants. If we find that we cannot place an immediate implant because there has been, the infection has been excessively destroying the bone. So we know, that's why we have additional training. We learn how to salvage a situation in case, let's say we use a surgical guide, the surgical guide doesn't fit, the surgical guide, maybe it's processed with some errors, we can do freehand implant placement. So we are trained analog and we are trained digital, so we have additional options or additional routes to take in the middle of the procedure if things have not gone as planned.
So I think it sounds like being flexible and knowing what to do in unique situations is what's critical to success.
Yeah, and within our specialty, because we're limited to prosthodontics and the oral implantology, we don't do root canals, we don't treat pediatric patients very extensively, or we don't really have orthodontic services in our clinic. So within our specialty, we do know how to salvage a situation, but we discuss with our patients, they are prepared. We tell them, if this is how we find your situation in the middle of the procedure, we go that route, or we go that route, so they know, they are prepared. We let them know.
Got it. Now, even with the all the preparation and even with all your experience, I'm sure that you've run into some particularly challenging cases in your experience. Would you mind sharing maybe just one or two stories of a particularly challenging case that you ran into and how you were able to achieve a successful outcome for them in the end?
Well, let's say a full mouth rehabilitation. A full mouth rehabilitation, it's not so easy to achieve the success, to achieve the route from point A to point B. It's quite long. So, for example, teeth in a day, teeth in an hour. So what you see over there and out in the industry, there's very inviting. It's very, very convenient for a patient to think that they're going to receive the final teeth in one day. But we find challenges from the standpoint, each patient is different. So they have a high smile line that will show the smile line. We either, build the bone or we take the bone away. There's multiple temporaries, multiple sets of temporaries prosthesis before going into the final. So this will be maybe one story that I will share with you that, where we never promise from the very beginning, yeah, we can do this, don't worry, it's going to be fine. We allow the patient actually to come in with their own request and participate to the process. We let them choose the shade. We advise them this is probably better, but we discuss about materials. We'll let them design their own teeth. They're coming in and we're not imposing one set or one set of teeth, or this is the only one you're gonna get. So challenging situation, challenges in finding the bite position, the proper bite and the proper alignment of the teeth. We do have patients with pain management that go through a lot of other medical procedures, and the whole body, like I said, it functions as a unit. So we are very patient. We allow our patients to intervene and participate to the decision-making process. We make multiple sets of temporaries, even if it exceeds the couple of 2 or 3 sets that we initially started with. What can I say? We service the public. It's difficult because it is also a business, but healthcare comes first in our office. So even if the situations are becoming more involved and we open the Pandora box, we still on track to finish.
Okay, that's good to hear. It's great to hear that there's, even with all the complications, there is hope for people.
There is, yeah.
It sounds like from what you've mentioned, a lot of people that come to you, they've lost that hope, but you're able to give that back to them, and even in very tough situations, there's still an option.
Yeah, we do have patients that visit our office coming from multiple providers, visiting with at least 2 or 3 other different offices before, making a decision. And even after meeting with us, they sit on their options, and it's a full mouth rehabilitation takes about 5 to 7 months to actually, come through. They patients are more or less learning by meeting with the different providers what the options are. And then at the end, after 6 months or so, they choose a provider, and then the journey starts. And even when we start the journey, there's still challenges, and there's still, things that have to be discovered. That there's a relationship, there's a commitment, there's a lot of other things that are coming into play.
Got it. Now, Dr. Garbacea, where do you think the future of dentistry is going? We talked a little bit about AI and the new technology, but where do you think the future is going?
We're going to 3D print everything, probably. Dentures are still going to be treatment options because there are a lot of edentulous patients. I think implantology will be an option, but as I mentioned, AI, they are trying to use stem cells to actually regrow teeth. So there might be a possibility where from stem cells, a new tooth, biologically compatible DNA and all that will be most likely the first choice treatment option, first choice. In the future, 3D printing will overcome and take over milling for sure. Images and robots and scanning, photogrammetry scanning, and different other types of scanners are going to come through as well. We truly believe that we're merging more and more with the AI, and a certain moment, I think we're going to have robots in our office. For sure.
The near future, right?
Yes, we're going to have assistants, we're going to have lab technicians, we're probably going to have someone in the front office or even placing implants in 20 years or maybe even sooner. Yeah.
Wow, it's interesting. It's fascinating that AI is so prevalent in medicine, because I think most people think about medicine and like how slowly it moves or how slow it is to take innovation and really start implementing it. But it's fascinating to say that in dentistry, like they're really embracing that new technology, and it seems like it's going tremendously faster than a lot of other medical disciplines?
Yeah, well, Gen Z right now that are in dental schools, they are really looking into not even have a model. They don't want to. Don't want to pour don't cast. They want to do everything on a full digital workflow. They want model-less dentistry. They are very receptive to all the innovations and the advancements in AI-generated scanning images, all treatments that are coming in. It is very fascinating. We're learning. We cannot stand still. We're always learning. We're great students, and we have a lot to offer to our patients.
Yeah. And speaking of learning and students, I'd like to talk a little bit about you being a teacher. You've been teaching for 10 years. So how did you get into teaching, and how do you find that it kind of helps you in what you do in your day-to-day?
Yeah, I like giving back. I like sharing from my experience. I do have hundreds of slides with my patient information, and I love being affiliated with Loma Linda University. I feel home over there. We are students. We always going to be students. We have to share with the new generation, make them better than we are. There's no secrets to hold back. We really share everything that we know with our students at Loma Linda. Sometimes we supervise 2 surgeries in the same time, and the clinic. Everybody's willing to learn. Our students are great. I love teaching. I don't know how should I say this. I once I feel that I know something very well, I want to share with my colleagues or with my students. And we're still taking a lot of courses right now. Even right now, I just came from Pacific Coast Society for Prosthodontics meetings just this past weekend in Monterey. I met my previous program colleagues, and there's a lot of students in there. It's beautiful. It's just the way it is. We have to share and we have to keep learning, and that makes us a whole.
Got it. That's fantastic. Now, Dr. Garbacea, I have one last question for you, but before I ask it, I want to point people to your website at www.lagunahillsprosthodontics.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting implants done or some type of prosthodontic procedure done, but isn't sure which doctor to choose?
Yeah, that's a great question, because there are very good practitioners out there, great general dentists, and almost every specialty places implants. All the general dentists go through the training. For our patients, I would say implants have to be planned correctly. So first we plan the final restoration, the final crown shape, and then we plan the implant placement. It has to be how we call it, prosthetically driven implant placement. So we build the house, and then we know how the house wants, how many rooms in the house, the general architecture of the house, and then we build the foundations from the end result, taking steps back, and then choosing a provider. Of course, credentials are important. What implant choice is important, graft materials, it's a whole package. So I would advise them to consider carefully the provider they're choosing to work with, and ask all the questions. Learn about their credentials, their technology that they have in the office, step-by-step procedure, what is offered to them, and there's no problem out there to choose the most affordable options, because spending money is very important for everybody, and you want to get the best quality, the best product for the money you pay. So I totally agree with a careful selection of the provider, and a careful choosing the relationship, because it's a long relationship. It's not just 1 month, 1 week, or a couple of days. When placing an implant, there is a journey. It's at least 3, 4, 5 months or 6 months in and out of the office. Make sure that the team meets the criteria of taking care of you and welcoming you, and also walking you through all the steps from the beginning to the end.
Got it. Well, there you have it, Dr. Garbacea, sharing your expertise. Now,
Thank
Doctor, where can people contact you and your practice?
Oh yeah, we do have the website, and we do have our forms that are going to be fillable within the website. We're planning right now to actually recreate our website. Phone number 949-951-7988. This is our clinic phone number. Website, it's drgarbacea@gmail.com. We do have an Instagram. We do have a YouTube channel that is populated with some information. If they wanted to fill a medical health history form and a couple of other forms, they are fillable on the website, or they can just call our office, and we are happy to send them through the email. With the new updates of our system, we're going to be able to submit those. They will be automatically submitted to the patients via email.
Nice. Well, Thanks for being on the show and sharing your message.
Thanks for having me, Daniel. It's been a pleasure. Thank you very much for your time. Yeah, we're here. Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.